Before we commence, let us unite in a moment of prayer, embracing the divine energy that binds us all. With humble hearts and folded hands, we seek the blessings of the divine for the successful and harmonious conduct of this event. Let's commence this enlightening day by lighting the lamp, followed by the prayer.
ॐ अमृतेश्वरी नमः 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 ध्यायामो धवलावकुन्दनवतीं तेजोमयीं नैष्टिकीं स्निग्धापाङ्गविलोकिनीं भगवतीं मन्दस्मितश्रीमुखीं वात्सल्यामृतवर्षिणीं सुमधुरं सङ्गीतनालापिनीं श्यामागी मधुसिक्तसूक्तिम् अमृतानन्दात्मिकाम् ईश्वरी ॐ अमृतेश्वरी नमः ॐ अमृतेश्वरी नमः ॐ अमृतेश्वरी नमः
Now we will be beginning. Dr. Suchismita Acharya from IUS Research Incorporated, Fort Worth, Texas, USA, University of North Texas Health Science Center. To introduce and extend a warmest welcome to Dr. Acharya, I invite Dr. Akhil Shivan, Assistant Professor, Department of Chemistry, to the stage.
Thank you, Radhika. A warm good morning to one and all present here. So this is the third and final day of the international conference that we are organizing. So good morning all. So it's my pleasure and privilege to introduce the first keynote lecture of the day by Dr. Sushishmita Acharya. So Dr. Sushishmita Acharya is a founder and CEO of IUS Research Incorporation, a startup pharmaceutical company in Fort Worth, Texas. Dr. Acharya is a highly successful pharmaceutical scientist with over 15 years of experience in drug discovery and development with companies like Alcon and Novartis, where she has been involved in the entire life cycle of drug development to the commercialization. She received her PhD in organic chemistry from the Indian Institute of Chemical Technology, Hyderabad, and trained as a medicinal and pharmaceutical chemist during her postdoctoral research tenure at the University of Texas Southwestern Medical Center, Dallas, Texas. She is highly experienced in designing and optimizing lead drug molecules for neuroscience, ophthalmology, respiratory, immunology, oncology, cardiovascular, and inflammatory drug discovery and development programs. After completing postdoc research, she joined Alcon Labs in 2002, the world leading pharmaceutical company in ophthalmic drugs discovery and development. where she conducted anti-glaucoma and anti-AMD drug research and development. From 2011 to 2013, she worked with Novartis Institute of Biomedical Research, conducting seminal discovery in new anti-AMD and antiviral conjunctivitis drug. Since 2016, Dr. Acharya possesses an assistant professor position in the University of North Texas Health Science Center at Fort Worth, Texas, in the North Texas Eye Research Institute and contributes significantly to teaching and optic neuroscience research. She is the inventor of more than 10 patents and published book chapters and more than 30 research publications in peer-reviewed scientific journals. The list of awards includes she has been nominated for the Ernst Young Entrepreneur of the Year Award 2023, DCEO magazine cited as a pharma pioneers in 2022. She got two Rising Awards in the year 2022 from Tech FW and from 2020 from BioNTX. She has been nominated for Norman Hegman Award in Chemical Research from the Welsh Foundation, Texas in 2020, and she has been the second place winner at the RC conference in 2020. She has also been got the award of Defense Innovation Technology from Tech Connect US Development and Department of Defense in 2017, and she has also got Novartis Spotlight Award in 2012. So with all these words, let me introduce Dr. Sushmita Acharya to deliver her talk on the topic novel small molecules and their biodegradable sustained release delivery platforms for respiratory, ocular, and cardiovascular diseases. Over to you, ma'am.
Thank you very much for the nice introduction. Let me share my screen. Can you able to see my screen?
Yes, ma'am.
Okay. Thank you very much for giving this opportunity to speak about my research. My my journey started with Alcon, as you already heard. I am a trained medicinal chemist, so a lot of small molecule drug discovery and development. That's what I did throughout my last 25 years of career in research and drug development. So today I'm gonna share with little bit of every little research from respiratory, ocular, as well as cardiovascular, especially using small molecules, how we can address some of the key pathological condition that leads to these diseases, and what are the I started my career as chemist, but then I work in a lot of interdisciplinary, which usually we need. So as you all hearing in this conference, very different, diverse topics. So my talk could be a little bit more heavy on biology or therapeutic or things like that. So pardon me if I go heavy on them, not too many chemistry, but it's all related. So with that, I have a disclosure that I'm also the founder and CEO of this company, and I'm an assistant professor in the pharmacology neuroscience at North Texas Eye Research Institute. Let's see. Okay, so my outline of the talk in next 40-45 minutes would be I will give you a little bit of background on different diseases, their clinical feature and current therapies, and what are the gaps we identified and why we are working on these diseases. And then obviously our approach, our small molecule approach to find some pharmacologically benefit, as well as the drug delivery approach, like, okay, how we can find out the drug is actually reaching to the therapeutic site or not. And what are the success, where are we, and also what are the future perspective of these projects, where we are going. So yeah, very basic concept you guys might be very familiar with. Nothing new. Just to start with my talk is most of my small molecule design and approach to different therapeutic areas spans from a very common idea of oxidative stress. So what is oxidative stress? Right? Oxidative stress is a bodily condition that happens when your antioxidant levels are low. And these levels can be measured through your blood plasma. And when there is an imbalance of the reactive oxygen species, also known as free radical, as you see here in this little cartoon, that a compound which has a lack of electron in its orbit, that is very prone to, this is like a free radical with a missing electron, and it is looking for to complete its orbital, which actually an antioxidant can provide, right? So this is a very basic fundamental chemistry question. Here is a stable molecule with all paired. The antioxidant have excess electron where the free radical has a missing electron, and that what composes of our superoxides like O2 dot minus or hydroxide radical, which is generated from hydrogen peroxide or any other reactive oxygen or missing electron like superoxide forms from oxygen. And this is a very common correlation you can do, that what happens when there is oxidative stress happens to a something like a fruit, right? So when it is decomposing, this is also an oxidative stress. So basically the cellular death. So here is a normal cell. Here is a cell attacked by free radical, and then the cell with oxidative stress basically burst and die. Their cellular function is disintegrated. Their mitochondria are not functioning, so they basically die. So this is a very high level fundamental of oxidative stress. But going to the different disease indications, how we can relate to that, let's look at that. And a lot of the diseases in our body, we have been exposed to oxidative stress at some form, right? So let me I'm gonna talk a little bit about these three conditions. So let's start from the left, which is lung. So I have been working in the oxidative stress, the hyperoxia, hypoxia condition in the lung that can actually occur because of several environmental cues, something like air pollution, tobacco smoking, your unhealthy habits. There are also pollen allergens, bacteria infection, and also metabolic condition like obesity, which can cause excess lipid peroxidation and generation of free radical, and also the hyperoxia, hypoxia. So when hyperoxia, hypoxia happens is basically if the lung is more exposed to um, ventilator or something like that, then you are basically forcing the too much oxygen to the lung. So it is good up to certain condition, but then excess of oxygen can also produce the free radical, so that also damages the lung tissue. Going to the right side, which is another condition called the peripheral arterial disease, it usually happens to the people with cardiovascular issues, like they have a clot in their arteries. So this is a normal artery looks like, where you have nice clean blood flow going on. But when it is clot with plaque or atherosclerotic, like a deposit of your cholesterol, lipids, or some kind of blockage, then that is called, that also causes oxidative stress and formation of lipid peroxidase products, and that can block the artery. And then once the artery is blocked, you have very less blood circulation. So if your blood is not circulating, the basically your other organs are not getting enough oxygen. So that condition is called hypoxia. So hypoxia also leads to oxidative stress. And then going back to the eye, which is my favorite organ, I'm working for multiple years, and you can see that oxidative stress is very common in eye because our eye is exposed to sunlight. We are, as we are aging, as we are getting stressed with UV light and also external things, so then the eye get exposed to too much free radicals, and it generates the free radical and targets different anterior and posterior segment of the eye, so that can lead to oxidative stress. So we're going to look at a little bit of every organs and see how we identified the disease and how we identified the small molecule, and that can be helpful in basically either preventing or treating these diseases. So let's start with the eye. So this is the typical anatomy of the eye, and you can see the front of the eye. You have your lens. This part of is called anterior chamber, and the lens here is your cornea. This is your ocular surface. This is your back of the eye, where you have your retina is lining in the back of the eye. That's where your neural layers are present that connects to the optic nerve and sends the vision signal so that we all can see. And this is where your optic nerve. So when oxidative stress happens, it can actually affect both the anterior segment as well as posterior segment of your eye. So let's look at one of the disease called glaucoma. So if you might have heard this name, glaucoma is a optic neuropathy. So what is optic neuropathy? That means degeneration of your optic nerve, and it is characterized by progressive death of retinal ganglion cell, which is present here, and elevated intraocular pressure. So the main cause, there are a lot of debates, like maybe because of high intraocular pressure buildup in the eye, it actually puts a lot of pressure to the retina, the optic nerve head, and then you will have a optic nerve cupping. So your normal optic nerve head looks like this. When you have glaucoma, it's kind of like cupped. Okay, so it is carved. So a lot of the neural cells are lost. And there is another cell here in your front of the eye called trabecular meshwork. It's like a meshwork, like it said. It's like a drainage system where your eyes have your ocular fluid called aqueous humor that is actually basically rich in nutrients that flows throughout your eyes and provide nutrition and keep it wet. And if for some reason, especially due to oxidative stress, aging, and different causes, if this trabecular meshwork is blocked, then you basically cannot have this flow maintained, and that's why the intraocular pressure increases inside your eye. That causes optic nerve head cupping and death of your retinal cells, and that basically leads to the visual field loss. People can see, they can go bilaterally blind, and there are this prevalence is really increasing. I mean, 100 million cases almost by 2040, and there is no cure. It's only maintenance. So maintenance by eye drops. So there are several eye drops available. They have different class of compounds. They are small molecules, and eye drops, prostaglandin analogs, beta adrenergic blockers, and alpha adrenergic agonists as well. There are some new class of compound recently come. It's pretty much like a hybrid of two drugs. So either beta blocker plus carbonic anhydrase inhibitor, because they wanted to, the physician wanted to have better effect. Where one drug is not really working, then you can actually add, thinking about combining the therapeutic effect of two drugs, and that might help better. So there are eye drops that can control the intraocular pressure and eventually control the optic nerve head cupping and death of retinal cell. Well, a lot of times patients do not respond to this, so they have to go through surgery to remove the clogging of the trabecular meshwork, and that surgery also has a lot of other complications. So yes, there is an unmet need. There is a research going on to find something which is much better and effective. But also with that, let's find out what are the gaps, why we need another drug, right? There are so many eye drops you already saw, and that's been here for like 20, 30 years. But the gaps are really, we are not addressing the multifactorial pathobiology of glaucoma. Glaucoma is a group of disease. It's not like one condition. And because it is killing your front of the cell, the cell of the front of the eye as well as back of the eye. And what are the regions? There are multiple regions, and one of the region is oxidative damage to both TM and retina, optic nerve. There are vascular pathology associated with. Patient compliance is another issue, like daily eye drop versus once in 3 days. So maybe these patients are old, they are age related, so they might forget to take the eye drop. So there is a lot of compliance issue. There are some non-responder, so there are different to address these things. So what we are working on right now is to looking at the oxidative stress part, and we wanted to see that the main cell, which is trabecular meshwork, which is clogged, causing elevated pressure, is it because of oxidative stress? Yes, a lot of the clinical samples from glaucoma patients show that they have decrease in antioxidant system, and there is increase in malonaldehyde, 8-hydroxy diguanidine, kind of, which are oxidative products, and that leads to chronic intraocular pressure. So with that idea, one of my PhD student, his name is Charles Amankwa, he actually looked at clearly that, hey, let's look at the oxidative stress and mitochondria relationship. And basically, as you know, follow through this, the different stages are because of oxidative stress, there is generation of ROS, activation of different transcription factors, as you see, leading to cellular translocation and angiogenesis, pro-inflammation, and so on and so forth, leading to apoptosis. So he just published a review paper here, very fresh from the press. And with that concept, we designed this small molecule, very 3-4 step synthesis. I usually like the synthetic methods which can be commercially viable. Yeah, we can always do 20 steps long total synthesis, but when it comes to commercialization and production, the manufacturing and process chemistry always become challenging. So with the goal, we try to design a compound with a two-fold activity. So it is a hybrid small molecule. The one half is nitric oxide donor, the other half is ROS scavenger. And this is a part called temple, and this is a sydenamine class of compound which actually releases nitric oxide when it's the pH goes above 7.4, which is your biological pH. So it's a very smart design to see that you don't need an extra enzyme to activate to release the nitric oxide, because nitric oxide is known to lower intraocular pressure by activating cyclic GMP and increasing the trabecular meshwork outflow facility. So we wanted to incorporate nitric oxide donor in the molecule, but same time our goal was, can we introduce also a ROS scavenger or antioxidant in the same? So this is a very smart design to show multifactorial activity. And with that goal, we actually progressed pretty well and published very recently this paper to show that this compound called SA2 actually has a multifunctional activity. This is your mitochondrial electron transport chain. Okay, this is your cellular membrane where most of the complex 1 through 4 and ATP synthesis are present. But if they are not functioning well, that can lead to generation of your superoxide. And superoxide needs to be dismuted by in the presence of your enzyme called superoxide dismutase. So superoxide dismutase helps to dismutate your free radical to hydrogen peroxide, but hydrogen peroxide also need to be disintegrated so to water, and that's where another enzyme called catalase and glutathione peroxidase is another enzyme which maintains the redox balance. So all these enzymes are very important to neutralize your free radicals so that they are not going to be available to to form lipid peroxidation product of your membrane and cell death. So what SO2 does is it increases all these enzymes SOD, GPX, catalase, as well as try to neutralize the nitric oxide bioavailability. So with all these multifunctional activity and broad spectrum antioxidant activity, we saw a very good result in a cellular assay. So these are the cells which are isolated from actual human eyes, and they have been cultured, and we looked at their cytotoxicity, their ROS benzene activity, their increasing superoxide dismutase activity, and they all are actually very well significantly increased as we expected. And overall what we wanted to see if these compounds really help in both primary normal trabecular meshwork cell, which is from a normal patient like us, and these cells came from a glaucomatous patient, and we isolated from the eye, culture them, then we looked at if we insult with a pro-oxidant, which increases the oxidative stress like tertiary butyl hydrogen peroxide, then we see a lot of cell death. And also the total antioxidant system decreases. But when you add our compound, it actually increases. So that means this compound is not only helping just to protect the cells, the normal cells, but also the glaucomatous cells from oxidative cell death. So that really proves our hypothesis that these compounds can protect the cells in vitro. But how about in vivo? We also looked at that. But here is another evidence that it also helps in decreasing the malonaldehyde formation, which is another key player in the oxidative stress. Then we looked at a very important thing, which is mitochondrial function. So what is this is a assay we use called seahorse assay that measures when the cells are stressed with mitochondria complex inhibitors, complex 1 to 4 inhibitors, then there is a decrease in oxygen consumption rate. So the question is, can our compound increase the oxygen consumption rate or extracellular acidification rate? So basically the oxygen consumption rate measures the OXPHOX or the ATP synthesis by mitochondria. And then the ECAR, which is the extracellular rate, measures if we are producing energy by glycolytic pathway. So there are two pathways that produces ATP in the mitochondria, and this compound helps in both way to produce ATP. That means it is bringing back the mitochondria into action where it's supposed to be, which is very fascinating. And after learning all this thing in vitro, we decided that hey, these are the small molecule we understand, this could be very useful as a eye drop, but is it really going to provide us a sustained release eye drop formulation, which was, as you remember, initially we identified that would be the gap. So now what we did is we took the nano suspension, nanotechnology drug delivery into picture, and we actually use PLGA, PLA different combination to encapsulate this small molecule, and then measured, of course, their stability, their drug release profile, and also using TEM, what the size looks like. We published it very extensively. And this is a very good opportunity for us to see that if the drug release profile is good enough to lower IOP for longer time period and providing a protection to the eye. And and we also looked at the pharmacokinetics and biodistribution, so which is like a typical way to measure whether the drug is actually getting into the right tissue of the eye, and if it is getting into the tissue, how long it is staying there. So what is the kinetics looks like, and is it actually a eye drop as an eye drop from topically applied? Is it actually penetrating all the membranes and going to the back of the eye or not? So that study shows that yes, our formulation is very effective and it's going inside the back of the eye. And next, what we did an experiment, two experiment. One is called Morrison's rat model of ocular hypertension. What that does is you basically inject a hypertonic saline to the episcleral vein of the eye that increases the pressure of the eye. So that's what you see the red line. And then when we added our SA2 nanoparticle eye drop, and then you can see the pressure goes down almost to the baseline and stays really longer than 72 hours, 3 days, just one eye drop. So we also added in another model that shows, this is a rat model, this is a mouse model, and they both are glaucoma model. They're showing clearly that there is a nice decrease in intraocular pressure, which is also decreasing the aqueous outflow. Remember, I told that the trabecular meshwork, if it is clogged, it's like a sink. So if the sink is clogged, then there will be no flow, so there will be pressure buildup, right? So if we clear the sink, then basically you are increasing the outflow, so the sink is running, and then the outflow increases, and then the pressure decreases. So that's the therapeutic applicability, which we proved both in vitro as well as in vivo model. Then we did a model which is very recent, and this is our hypothesis, that can we design a drug and formulation that the patient don't have to take every day a drop, but maybe once in a week. So with that kind of design and planning, my student, Mr. Amankwa, he did this experiment. He did actually day 0, day 6, day 12, three eye drops. And now we see a very constant IOP lowering effect. So the red one is a blank nanoparticle, which is lowering slightly, but it is going back because it doesn't have anything. The drug is not there. But the blue line shows that it's constantly keeping the pressure down, and that's what exactly we need for the patients. The pressure need not to be fluctuated. If we have an eye drop in every 7 days and it keeps the pressure low, then that's where we can able to control this disease and not really damage to the back of the eye in the retina, and can save the patient to go blind, right? So with this is again in the mouse study, and as you all know, mouse is not human. So we have to again uh, work on larger animal eyes. So now we are working on rabbit eyes, and we have also planned to study this in mini pig eyes, which is pretty close to human eyes, and that would be more translational to the clinic. So that's the story of my eye, and I will quickly also show that some other exciting results we did on hind limb injury and on the disease called peripheral arterial disease. So peripheral arterial disease can caused by cardiovascular metabolic defect. So people who have high cholesterol, existing problems, or somebody who sits for a long time, they can have also this disease. So basically, if you can look at here, a healthy artery in your limb, lower limb of the foot, looks like this. If it is atherosclerotic artery, then it looks like clog. So what is happen when it clog means there is no blood supply. That means there is less oxygen in the blood, and that condition is called ischemia or hypoxia. So ischemia, and then after that, if you have a reperfusion, that means there is a short period of lack of oxygen and then suddenly you have oxygen flow, then that becomes hyperoxia or reperfusion. That means there is too many oxygen, and that can lead to again superoxide generation, mitochondrial dysfunction, and leading to your altered homeostasis of your myocytes, and that leads to muscle weakness, diminished exercise capacity, and so on, so forth. But this is a huge problem, especially with people with diabetes or metabolic disorder like cardiovascular diseases. So how is there any solution for this thing? So what we want to know, we again want to find a molecule which can increase the blood flow, prevent the endothelial dysfunction. So endothelial cells are the lining of your blood vessels, and if they die, then you don't have a blood circulation. So you want to prevent that. And nitric oxide again is a very magic molecule that can relax the endothelial cell, I mean vasculopathy, inhibit the vasculopathy, prevent the endothelial cell dysfunction, and can allow for good blood flow. So with the same concept which we applied for glaucoma as SA2 compound, here is the second generation compound SA10, and that has both again nitric oxide donating as well as RO scavenging ability, but here we have a sulfone RO scavenger. And this compound, we published this in 2021. We have also tested this in vitro and animal model and made a nano suspension, again slow release. For this time we did this one for IV intramuscular injection, and we wanted to see that can we able to increase the blood circulation in the limb and able to allow these mice to really walk like normal limb. So that was the goal. So with that, we again prepared the nanoparticle with the right size. The size is less than 200 nanometer. PDI is pretty good, and the zeta potential is negative, so there is less aggregation, smaller size, distribution is good. And now we looked at the drug release profile of them, and yeah, that's pretty good, 80% drug release in 5 days. And we also looked at the cellular efficacy of them, which we published in this paper. But what is more important here is, and very interesting, is we did inject these nanoparticle in two route of delivery to the mouse to see that which one is more effective. And now we see that IM in the intramuscular injection is actually better than intravenous injection, because you can see that in the limb where there is more hypoxic condition, it actually accumulates there. And that's what we wanted, that the nanoparticle stays longer time in the diseased tissue. And we have quantified them, and you can see that the highest concentration of the nanoparticle is in the muscle. And we did a mouse model to show if this is the model where you can see the healthy limbs have good blood circulation, all red. This is by the Doppler method, and here you can see the ischemic are blue, and with the nanoparticle, which is green, you can see, so this is normal, this is post surgery where you have ischemic limb, And after injection of intramuscular injection of SA10 nanoparticle, it clearly increases the blood perfusion as well as exercise capability, which is very exciting. So we wanted to really work on this project to take it next level, which my collaborators are working on. Hopefully someday we'll find a intramuscularly injected nanoparticle drug to be applicable for human use. But yeah, so that's pretty much for my academic work I did. I wanted to acknowledge all my lab members, a lot of collaborators without which this is not possible, as well as funding, and my institute, as well as my student, my group, and my extended group. Quickly, in next 5-10 minutes, I wanted to speak about, so this is my academic endeavor on glaucoma and peripheral academic arterial disease. But in my company, I just wanted to briefly say that we are working on the lung and the oxidative stress in the lung, chronic lung injury, acute lung injury, infection, and everything. And our small molecules are all designed from a biopolymer natural product, which is an oligosaccharide moiety called chitin or chitosan. You might be familiar with that. These are derived from crustaceans, the shrimp shell, and they're very insoluble compound. They don't have a drug-like property. So what we did is we break it down to smaller fragments, make it one or two sugar, but with some chromophoric and compounds which will be helpful, like a more drug-like property. And we found one compound, AVR48, with a very small molecular weight. And I will briefly go over that what is our endeavor in IUV's research in saving babies' lung from injury. So this is a global, epidemiology to show that how neonatal deaths are 46%, and when they're preterm birth, that complication goes up. And these babies which are born prematurely, their lung damage is very evident because they have been kept in ventilator for a long time. So they have been exposed to oxygen really hard, so their underdeveloped lung cannot take it. They also go through another condition called retinopathy of prematurity because their retina is developing. And now we are putting them in high oxygen. So there is a vasoobliteration. The vasculature does not develop in the hyperoxic stage. And when they're taken out of the ventilator, now they're hypoxic. So now everything screwed up, or they became the HIP1 alpha become activated. The angiogenesis is really proliferating, and they have bloody eye and retina detachment. They can go blind. So can we save these babies lung and eye? I'm not going to talk about the eye because it's pretty much same way we can handle, but the long part is what we are working on in the company, which is our this first candidate is moving to clinical trial this year. So this is the condition called bronchopulmonary dysplasia, where the baby born very prematurely, kept in the mechanical ventilator, they have lung damage, they can either end up in BPD or death. And there is no FDA approved therapy. There's some steroid, caffeine, vitamin A is off-label used, but it's not effective. So basically, their lung are underdeveloped and their prematurity interrupts their development. That's why and if we cannot prevent this damage early on, that becomes a permanent damage throughout their life. So this is definitely devastating. But what this is one of the slide I always show. This is we interviewed one of the family whose baby actually born prematurely and actually died. She was surviving, but she stayed so long in the ventilator. Eventually, there was no opportunity for her to survive. So we are working on oxidative stress is one of the major player, leads to inflammation. There are a lot of imbalance in the growth factor, and then cumulatively it is basically injuring the lung. So we have developed an intranasal inhalation of this drug called AVR 48 nanoparticle, and that leads to basically we can see that the intranasal inhalation, the drug is getting into the lung, and there is a nice release curve also here. So we are now working on two formulation. One is intranasal inhalation, the other one is IV drug too. And we are doing a large animal clinical trial in preterm lamb model, where the lambs are born exactly prematurely, like the premature babies. They're kept in the ventilator, exactly same as NICU, all the parameters. Then we follow them like we follow with the full term baby with the mask. We also follow them till they are 90 days and how they are growing, just like we follow the toddler, how their lungs are developing, their brain are developing. So this is a huge study going on with the company, and we have really nice data from the large animal that shows that treatment with our drug significantly decreases the oxygenation index, respiratory severity score, which is all good indication that the lung is really developing well and functioning well. Um, and yeah, that's pretty much it. This is my team at the company. We are gearing towards bringing this drug to the market for helping these premature babies to breathe well. And this is my final slide. My summary and perspective is oxidative stress, mitochondrial dysfunction leads to hyperinflammation, and they are the main pathological factors in several diseases. So small molecules like SA2, SA10, AVR48 with broad spectrum antioxidant activity, as well as other immunomodulatory activity, as well as their sustained drug delivery, may have potential to prevent and treat such disease. However, more research and development study as well as clinical trial are required, and that's in the horizon. So hopefully we'll have a um, few drugs in the market to help people from these diseases. Thank you very much, and I'll be happy to take any questions if you may have.
Thank you, ma'am. Now this session is open for discussion. So if you have any queries, you can ask.
Thank you, ma'am, for the enriching presentation. I have one query, ma'am, regarding the
Sure.
release mechanism of the nitric oxide you were showing in.
Mhm. Yeah, sure. These are sidomine, the five-membered ring. So if you are familiar with the drug mulsidomine, so mulsidomine is a prodrug of a compound called SIN1. So if you really look in the literature, you will find it. So SIN1 is a sidomine, the five-membered ring. So when the pH is above 5, so it's 6 to 7, then it protonates and open up and release one molecule of nitric oxide. So that's the mechanism. Did I
Okay,
answer
ma'am.
your question?
Yes, ma'am. Yes, ma'am. So basically, under acidic pH only, this drug will be effective.
No, the drug is more stable on acidic condition. When it hits to biological pH, so it's higher than 5, so like 6 or 6.5 to 7.4, then only it will start releasing. So
Okay, ma'am.
that's why
Okay.
you can formulate it as slightly acidic formulation, but as soon as it touches the physiological pH, then it will start releasing.
Okay, okay, ma'am. So, and one more query, ma'am. So, for
Sure.
the ischemia portion of your presentation, you were discussing about the like site-specific localization of those PLG and nanomaterials. So, how
Mhm.
are you achieving that, ma'am? Like, how are they getting site-specific?
So the compounds, so what we did is we wanted to see the hypoxic tissue has more propensity to attract these molecules towards themselves. So we created the model where the limbs are hypoxic. So we basically tied a rubber band into the limb of the mouse, and then they became hypoxic for certain 4 hours. If you tie, then that limb is hypoxic. So when we inject the ICG loaded dye, we saw that uh, the hypoxic tissues have more propensity to take the PLGA nanoparticles to that. So that could be associated with the physicochemical property of your dye or your drug, but not really the PLGA or PVA, whatever polymer you are encapsulating would make the difference to know whether it is a hypoxic tissue or normal tissue. But it is more about the property of your compound, if it is going to the hypoxia region or not, that you can do it. And if your compound is an antioxidant and there is a hypoxic tissue, so you can imagine it will straight go there to capture or um, balance your free radical. So that was the main idea behind it. Did I answer your question?
Yes, yes, ma'am. Thank you. Thank you so much, ma'am.
Sure.
Thank you, ma'am, for a wonderful talk. So I'm having a doubt, like the two organic compounds that you have showed, one is N oxide, the other is sulfur oxide. Ma'am, is those two compounds are been designed by you or
Yeah. So those all these small molecules are designed by me and also synthesized initially. But yeah, we have a patent. We have patented those compounds.
okay, ma'am. Okay, thank you.
Thank you, ma'am, for the wonderful session. So I have a doubt.
Mm-hmm,
So, so when you shown that drugs which is used for the treatment of eye disease, so I just
mm-hmm,
went through the structures of those drugs
mm-hmm,
uh, using Google. So
mm-hmm,
what I found was uh, like I could see only cyclic structures with some linkers.
mm-hmm.
Okay. So usually, so what my doubt is there any advantage of using this cyclic cyclic structures with linkers, or have you tried any structures with merged structures, which is usually used for antiviral, antimalarial, all those drugs, the common drugs? So why did you prefer the cyclic structures with linkers rather than going for the normal pattern of the drugs
Yeah.
which are merged?
Yeah. So I think your question is hybrid versus linker,
Yes.
right? So you can always attach two molecule with a linker with two different properties, but there is no guarantee that they will give you the normalized therapeutic activity. So if so lot there are two ways you can design you can combine compounds, actually three ways. One is physical combination, right? You can just combine two drugs in one bottle. And then the other one is you can join two drugs with a linker. And the third one is just make a hybrid. So hybrid means there is no linker, they're one molecule, but with two property. And that's what I like, because the linker is not always, it does not work always, unless it is specifically designed based on a structure based design, like you have one ligand site here, another one here, and you exactly need a linker, then it will work, possibly work. But there is a very polypharmacology difference, because it may not really produce you the efficacy or IC50 or binding efficacy or things like that. But when you have a hybrid molecule, it can have two different activity, but they are one molecule. So that's what I selected or I designed. There one part is your antioxidant, the one I showed in red, and then the blue part is your nitric oxide part. They're actually fused together, right? There is no linker inside. So that's my compound. But is that your question? I'm trying to really understand if I answered your question or not.
Yes, ma'am. Actually, I wanted to know the advantage of why the drugs which is used have linkers between them, and the molecule you designed was a fused structure. So,
Correct. So
is there any like advantage? That's what I want to know.
yeah, right. So I mean, people, you can design a linker compound. If you can maintain, it also depends on what is your purpose, right? So if you wanted, let's say, I was working on a project where we were trying to merge two therapeutic targets. Like one is a alpha 2 agonist, let's say brimonidine, which is a alpha 2 agonist, and then you join that with a timolol, which is a beta blocker, with a linker, right? So imagine alpha 2 agonist has a particular therapeutic activity. Let's say their IC50 is 10 nanomolar, and then your one molecule of the other molecule, which is your beta blocker or timolol, IC50 is 50 nanomolar. If you join them with any kind of linker and you expect that your activity after join will match or will average, will increase or will decrease, then that is very speculative. It doesn't happen. It basically doesn't add up. It doesn't go synergistically. So 10 plus 50 will not become 60. So how do you determine your therapeutic activity, your pharmacology, if you just join to linker? So that is the challenge in drug design when you go through the medicinal chemistry pharmacology. So that's why we did a lot of projects, and the success rate of those linker project is very tough. So that's why the fused compounds are more direct, because you can find a ligand binding site, you can find a target for them easily than the linker. So that's the challenge. But there are some compound where the linker also works, but it goes through a lot of iteration of research to find that molecule. It takes a longer time. That will be the short answer.
Thank you.
No problem. I enjoyed speaking with you guys.
Thank you, ma'am. Thank you for your
Mhm.
encouraging talk. Ma'am, I have a query regarding the polymer part. Like for the encapsulation of the nanomaterial, you have used PLGA as well as PVA. So whether
Mhm.
it is in the homopolymer form or a blocker polymer, and whether the hydrophilic nature of the polymer affect the drug loading efficiency. That's my doubt.
Yeah, it does affect actually. So we changed when the compound, our compounds are also very polar. So that's why the hydrophilic part, we use PBA, polyvinyl alcohol, in different percentage, I think 10% or so. I don't think it's a block polymer. Yeah, I don't think it's a block polymer. But it does affect, if we wanted to load a hydrophobic compound, it doesn't really help. It's more hydrophilic. Yeah.
Okay, thank you, ma'am.
Mhm.
Thank you, ma'am, for your wonderful presentation. I have my query is you have mentioned that SA2 nano drug, which is used as eye drop, their mechanism is by reducing the peroxide. And okay, so can these drugs be generally used for other oxidative stress related conditions such as atherosclerosis or ischemic brain disorders, etc.?
Yes, they can. They can be used for other conditions, and we have also tested for ischemic stroke. We also tested SA2 for lung injury. Yeah, because their normal mechanism is antioxidant stress. So any organ, if it be delivered in the right amount, therapeutic amount, then it will help it.
Ma'am, also, this hyperoxemic and also hypoxic both causes oxidative stress. So
Mm-hmm.
for hypoxic patients, the
Mm-hmm.
oxygen slow introduction of oxygen, can this reduce the risk of hyperoxemia?
Mm, yeah, that's a good question. So what happened in hypoxic stress? The hypoxic is actually more damaging because basically the cell does not get oxygen, the required oxygen. So there should be a balance always, right? So hypoxic is too less, and then hyperoxia is too much. So sometimes what you are telling, it's a good point. Sometimes we see that priming with hypoxia helps in hyperoxia. So that also there is a technique where especially for the limb injury in the cardiovascular, if you can give them transient ischemia, then they actually helps in the hyperoxia, too much oxygen or ROS generation. Yeah. But
Thank
if you do too much or too long hypoxic, then that's detrimental.
Thank you, Dr. Suchi Acharya, for this
Hmm.
wonderful talk and spending your time with us. I know it's like midnight, 12 o'clock for you, so sorry
Yeah.
to make you keep you
No,
awake
no, no.
to
It's my
listen.
pleasure. Yeah. Thank you
And
so much.
yeah, our group is actually working on these antioxidant derivatives like molcidamine and advero. So I think maybe I
Oh.
will talk to you more
Yeah,
about that.
maybe we should talk separately and try to connect any way we can help or collaborate.
Thank
Happy
you.
to talk to you guys. Yeah.
Thank you.
Have a great day. Yeah.
Thank you. Thank you much.
Okay. Bye-bye.
So I stand here truly inspired and marveling at the depth of knowledge shared by Dr. Suchismita. The insights shared were not only mind blowing but also immensely valuable. Once again, thank you, ma'am, for your enlightening presentation. Now, we are honored to have Dr. Manju Saraswati, Scientist E, Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum. Please join me in welcoming Dr. P.D. Pancharatna, Assistant Professor, Department of Chemistry, to introduce and extend our heartfelt welcome to Dr. Manju Saraswati.
Good morning, everyone. Uh, it's my pleasure to introduce the speaker of this session, Dr. Manju S., an eminent scholar and scientist from Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum. She started her career and joined this institute in 2018. And interestingly, it happened to be her parent institute where she had completed her PhD in 2012. So, in between this period from 2012 to 2018, she has a long and enriched research journey for her with experiences in an international level. Her postdoctoral stint includes her stay as a postdoctoral research associate at Department of Biomedical Engineering, University of Wisconsin, and later she was a postdoctoral research associate at Department of Pharmaceutical Sciences, South Dakota State University. She was also a postdoctoral fellow at Department of Craniofacial Biology at University of Colorado. Later, she was also a research associate at Department of Biomedical Engineering, Lerner Research Institute, Cleveland, during which period she has also worked as an adjunct assistant professor of molecular medicine at Cleveland Clinic Lerner College of Medicine in Ohio. After joining Sri Chitra Tirunal Institute in 2018, she has received the Hargobind Khurana Innovative Young Biotechnologist Award in 2020 from Department of Biotechnology, Government of India for her outstanding research contributions. She has published She has published more than 20 papers in highly reputed journals, contributed 3 book chapters, and have filed 3 patents in US as well as in India. Today she is here with us and we are delighted to have you, ma'am. And eagerly waiting for your talk. I extend our warm welcome to you to this ICAMSC conference and I request you to deliver the talk.
A warm good morning to all of you. And thank you very much for inviting me for this presentation. And thanks a lot for the kind introduction, ma'am. And today the topic we are going to discuss is plasticizer-free biomedical devices and significance of reactive nanogel additives. So the outline of the presentation is the significance of plasticizers in medical devices and the drawbacks of plasticizer leaching, the current strategies used to mitigate the plasticizer migration, and the effect of thiol functionalized nanogel as plasticizers. And also I will go through the recent technology that we have developed and transferred to Romson's, that is Chitra Acyloso respiratory secretion solidification system. And the conclusion. So, so what is a plasticizers? Maybe you all know it is a low molecular weight substances or the oligomeric substances that is incorporated into the plastic material to increase the flexibility and the processability of the material. And the plasticizers but exchange the intermolecular interactions between the polymer chains and form interactions between the plasticizer and the polymer chain so that it can promote the conformational changes and introduce the flexibility to the polymer matrix that decreases the TG, that is the glass transition temperature of the system, and the elastic modulus. So do you know what is the glass transition temperature of the system? Yeah, so the glass transition temperature is a transition temperature below which the material is glassy or brittle and above which it is rubbery. So this is the schematic representation of a plasticized polymer matrix. It shows that the plasticizer, that is the spherical representation that is shown in the figure. And and in the schematic that is shown The schematic that is shown in the right side that shows that means with what is the effect of plasticizers with and without plasticizers in the polymer matrix. So it can shows that means without the plasticizers, the rod is very brittle, and with the presence of plasticizers, it introduces the flexibility and it's easily bending and it can process for different applications. So the plasticizers are used in many biomedical devices, including IV tubes, catheters, blood bags, and etc., and also in very high concentrations. So there are different forms of plasticizers are used depending upon the polymer matrix, the parent polymer matrix, and also the application. So in PVC, that is the polyvinyl chloride, it's the different plasticizers, like especially the phthalate-based plasticizers like dimethyl phthalate, diethyl hexyl phthalate, that is DHEP. And in the case of PMMA matrix, polymethyl methacrylate matrix, there are like plasticizers like diallyl phthalate, and in other systems also there are many more plasticizers like the low molecular weight polyethylene glycol, glycerol, or bioplasticizers like olive oil. Means there are many plasticizers are using. But in the case of biomedical devices, the most of the plasticizers that is using is phthalate-based plasticizers, and it has lot of disadvantages and toxicity. So, for example, in the case of blood bags, means more than 30 to 50% phthalate esters are used as a plasticizer in order to introduce the flexibility and the flexibility suitable for that particular application. And for the dialysis tubing, around 80%. That means it's a huge concentration of plasticizers are using. And in dental adhesives and soft liners, the plasticizers like 47% of plasticizers, that is also phthalate-based plasticizers are using. And there are many reports that shows that these phthalate-based plasticizers are leaching out from the material and going to the blood, urine, or whatever it is that is in contact with the material. So there are many disadvantages. So in the case of plasticizers, plasticized polymer matrix, the main problem is that the plasticizer is only physically interacted with the polymer matrix. There is no chemical linkage between the plasticizer and the polymer. So the plasticizers are easy to migrate from the polymer matrix and then leaching to the immediate micro environment. That will cause lot of toxicity in the systemic circulation, systemically. So the plasticizers have implicated in causing birth defect. So there are many reports that shows that it has introducing birth defect, childhood chronic illness such as asthma, fertility issues, cancer, and all. Especially in the case of diethyl hexyl phthalate, that is used in many of the biomedical applications, that is having carcinogenic, and it is regarded as developmental toxins. And it is also known as the endocrine disruptors, and means it mimic the hormones such as estrogen, thyroid, testosterone, etc., so that it can introduce a lot of complication in the patient or who is in contact with this plasticized material. And there are report also shows that the plasticizers are responsible for negative impacts on neurodevelopment, leading to lower IQ and hyperactivity and attention disorders in children. So and this is also a study reported shows that it can also cause cardiovascular problems. So there are different strategies used to mitigate the plasticizer migration and the leaching. So for example, the plasticizers with the lesser propensity to migrate, that is by increasing the molecular weight of the plasticizers rather than using the low molecular weight systems. And use of hyperbranched plasticizers is the one strategy. And the another strategy is the use of surface treatment of the plasticized polymer network by means of plasma, gamma, UV radiation, etc. And also there are strategies that introduce the polymer plasticizers combinations with better compatibility, for example, with similar solubility parameters and dielectric constant. And the most important strategy is the chemical cross-linking of plasticizers in the polymer network. And that is what we are also concentrating by introducing the nanogel, reactive nanogel additives. So the objective of the study is the feasibility to use the reactive nanogel as plasticizers in the polymer network, so that it will be chemically conjugated to the polymer system, the matrix. So there will not be any migration or leaching of the plasticizers, and that introduce the even macroscopic changes in the particular matrix. So this is a schematic representation of the nanogel that we have synthesized. It's based on a thiolene-based Michael addition reaction using a tetrathiol like PETMB and diacrylate like UDMA, urethane dimethacrylate, and exothane, that is simply urethane dimethacrylate, extended PEG dimethacrylate, and glycidyl methacrylate. So by thiolene-based Michael addition reaction in the presence of triethylamine and TPP, we have synthesized this nanogel that is also thiol functionalized. So in Michael addition, it's like a step growth reaction. So it's like a 1:1 reaction of acrylic and thiol. So if we are choosing the feed ratio in such a way that the thiol is in excess quantity, we can get thiol functionalized nanogel, or in the other way, if we are taking out the feed ratio in such a way that the acrylic groups are more in the reaction mixture, then we can introduce the acrylic functionality in the polymer system. So here we introduce the thiol functionality by taking the excess of PETMB in the system. And then we have characterized different characterization techniques are used in order to confirm the thiol functionalized nanogel and the thiol groups in the system. So at different time period, we have taken the FTIR, Fourier transform infrared spectra, and the 814, that is the acrylic peak, the CH bending peak, we are getting at 814. And as the reaction progress, the peak intensity is reducing, and at around 48 hours, it's almost nil. But in the case of thiol, SH peak means it still have the peak after 48 hours. That is, it shows the presence of thiol group, free thiol group, even after the completion of the reaction or in the nanogel. So since we are introducing nanogel as a plasticizers, we need to have a nanogel that is having low TG, so low glass transition temperature, so that while incorporating in the material, we can have a system with reduced TG. So we have defined, synthesized different nanogels based on this thiolene based on nanogel, or free radical solution polymerization based on the tertiary butyl acrylate or PEG dimethacrylate or isobutyl acrylate or urethane dimethacrylate. And we have optimized this particular formulation because we got a very low TG value for this particular nanogels, that's around minus 31 degrees Celsius. And the nanogel, we also check the particle size and zeta potential of the nanogel to see that means how it is after the synthesis. And we got a size distribution of 190 nanometer and a zeta potential value of around 4 millivolt. So once we confirm the nanogel, the thiol, the functionality of the nanogel and the spherical structure and the size, we incorporated this particular nanogel into the exothane matrix at different weight percentage, and we use a photo curing technique to make the film in the presence of IRGA cure, that is a photo catalyst. And when we expose 10 minutes for all the film, and we check the conversion by FTIR to see, and we got almost like more than 99% conversion in all these film samples. And we have represented the samples, the film like E9, NG5, NG10, and NG20 based on the weight ratio of the nanogel in the matrix or the film. So in order to check the glass transition temperature, that is the crucial characterization in this particular study. So we have used the dynamic mechanical analysis technique, and you can see that the tan delta value of the parent polymer matrix, that's the exothane and NAN is around 62 degrees Celsius, while we are incorporated the nanogel into the polymer matrix at different weight ratio, the TG is also decreasing. For example, at 5 weight percentage of nanogel, the TG value reduced to 47, and at 30 percentage nanogel content, it even reduced to 19 degree Celsius. So that is very good, because at room temperature, even the material is very flexible, so that it will be suitable for any particular applications like blood bag or adhesives or soft liners, etc. So we also check the percentage elongation, of course, means as the TG is, if we are introducing the additional cross-linking and the TG is reducing because of this plasticizing effect, the percentage elongation is also increased, and it also confirmed from this graph, means as the nanogel loading percentage increases, the percentage elongation is also increasing. And the rubbery modulus also we checked at TG plus 40 degrees Celsius, and it shows that the rubbery modulus is reducing with the nanogel concentration, but it's okay. It's for that particular application, it's the modulus is good enough because it is still in MPa. And we checked the viscosity of the formulation with different nanogel concentration before curing, and it shows that as the nanogel concentration increases, the viscosity is also increasing, and the TG value of the film after curing is decreasing. So actually, the acrylic polymeric system, the percentage polymerization kinetics is a huge role. So we check the percentage polymerization of each film before and after the nanogel loading. So we can the graph shows that, means the polymer matrix, the base polymer matrix shows have a 80 percentage kinetics within like 30 seconds, but as the concentration of nanogel increases, it's going up to 100 percentage polymerization. And we also check the shrinkage stress and shrinkage stress of the system. So shrinkage stress is nothing but when we are polymerizing a monomer, because it's if we are going for a free radical polymerization, since it is a very fast polymerization technique, it will introduce a shrinkage stress, because shrinkage stress and also the volumetric shrinkage will happen. So that is not good for many of the application, especially in the dental application. So we check the shrinkage stress after, before and after adding the nanogel composition. So we can see that means the shrinkage stress is also reducing as the nanogel composition of the system is increasing. So that is a very good thing. It's very useful in many applications, especially in dentistry. And then we have checked the equilibrium water content and contact angle measurement of the system in order to see that how this nanogel composition in the base matrix will affect its bulk properties. Like so we can see that the equilibrium water content is there is no significant difference, but still slight decrease in equilibrium water content. That shows that the hydrophilicity of the system is slightly decreasing. That is mainly because of the cross-linking density of the system is increasing because of the reaction of this reactive nanogel with the polymer matrix, and also the contact angle. So these both equilibrium water content and the contact angle is now it is it's like a contradictory, but it may be the contact angle is decreasing, or the hydrophilicity is increasing after introducing the nanogel concentration, because we are introducing the thiol functionalized nanogel. So the thiol group, the hydrophilic thiol group is introducing hydrophilicity of the surface of the material. So that may be the reason it is decreasing. Then we have checked the refractive index and the percentage transmittance of each film before and after nanogel loading, and it shows that the refractive index is not have any significant effect with nanogel loading, and compared to the dry refractive index, the wet refractive index of the material is decreasing. That is as usual. And that the percentage transmittance is also, there is no significant difference between the transmittance after loading with the nanogel. So that is a good thing. That means there is no opacity or anything is introducing after we are adding the nanogel to the base matrix. Then we also check the stability of the system by thermal stability and also the hydrolytic stability of the material. The thermal stability, the thermogrammetric analysis shows that there is no significant difference, or the thermal stability has no effect on nanogel addition, and the hydrolytic stability is also not a significant difference, but still there is a increase in stability, hydrolytic stability after introducing the nanogel, reactive nanogel in the base polymer matrix. So we also check the preliminary cytotoxicity evaluation to see that whether the nanogel has any toxic effect. So it also shows that there is no significant, there is no toxicity at 10 till 10 weight percentage, but at 20 weight percentage there is a slight or mild toxicity it's coming. So but even 10 weight percentage of nanogel, there the TG is drastically increased. So it is good for that application. So it's like a, in general, we can use. So it's like a preliminary study that shows that the nanogel, the reactive nanogel itself can be useful for used as a plasticizer rather than using the toxic phthalate-based esters in many of the base metrics. So we are extending this study to different base metrics like PVC and PMMA and all. The studies are still going on. This is we just published this paper. Uh, and in conclusion, the thiolene-based PTMB nanogel can act as a reactive plasticizers, and the TG of this system film is reducing as the nanogel composition increases due to the plasticizing effect of this particular nanogel. So different aspect of this particular study is going on. For example, means how we can use or in constructing the blood bag, or how we can mitigate the plasticizer migration in blood bag. That is also using this reactive nanogel. That study is also going on. And in addition to that, we are also studying the plasticizer-free acrylic denture softliners. So softliners are nothing but it is the material that is used while we are using the denture, the artificial teeth in for a dental application. So in order to introduce the softness or the cushioning effect between the palate and the denture, we have to use soft liners. But the soft liners, there are different compositions of soft liners are available, like silicone based soft liners, acrylic based soft liners, etc. But in the case of silicone based soft liners, there is no good addition with the base denture material, because it's acrylic and another one is the silicone. So but the acrylic based soft liners have a very good adhesion with the material. But the problem with is that since it has a very high concentration, like around 50 percentage of phthalate esters are used in acrylic denture soft liners. So with time, like within 2-3 weeks, the plasticizers will migrate to the surface, and from there to the oral environment. So the material will become hard again. And also in addition to that, the whatever the phthalate leached into the oral cavity will go to the systemic circulation and cause toxicity. So this is another study that is it's a huge role of this reactive nanogels in this denture, acrylic denture soft liners of also. And for this particular study, I got Hargobind Khorana Innovative Young Biotechnologist Award, considering the importance of this reactive plasticizers to replace many of the phthalate-based systems that is causing toxicity. And so I would also like to go through my one of the recent technologies transfer that happened in our lab. So that is Chitra Acrylosome respiratory secretion solidification system. So that is actually, we started this work during the COVID time. And because the COVID means the main problem we were facing, or the main fear we have, is the contagious respiratory secretion during the first wave of COVID actually. So this contagious, it's definitely a problem because of the formation of aerosol or the spillage. Means this contagious secretion may cause contamination to many of our hospital staff, like nurses, nursing assistant, etc. So we were trying to find a solution for that particular problem, and then we come up with this Chitra Akalosop respiratory secretion solidification system. So this is the pictorial representation of our product that is already transferred to a different company. So why we need a respiratory solid fluid solidification system? So the disposal of infected secretions from the patient that pose a great challenge during COVID-19 and also in TB, tuberculosis and HIV cases where the secretions are very contagious. And then in usually what in the hospitals what they do is the secretions will be sucked by a suction machine into the canister and decontaminated while it full and in the sluice room and discard. So during that process, while we are opening, while they open the secretions with the contagious secretions, the aerosol can be formed, and there is a recontamination risk during handling, and the nursing and the cleaning staff will be at risk. We have find out come up with an idea of this Chitra Akalosop respiratory secretion solidification system, where this it is purely based on our superabsorbent polymer integrated with a wide spectrum disinfectant. So this and we have checked this powder based on the ISO standards, and this by a special technique we have integrated this powder, that is the superabsorbent granules with the disinfectant will be packed in such a way that the whole pack means while the secretions are collected in the the bag, the canister bag, it will be decontaminated immediately and solidifies, so that there is no fear of spillage or recontamination. And this the canister bag that shown the this picture that can absorb around 500 ml of secretions and solidify it immediately. In addition to that, the whole system will be decontaminated within no time because of the presence of a disinfectant, and it is also WHO accepted wide spectrum disinfectant. That is what we used in the particular system. The solidification and the immediate disinfection that occur inside these bags eliminate the secondary infections, and this canister bag are like a in a Ziploc cover. So that means once it is full, we can just lock it and keep it in another cover and even discard it in the usual dustbin. There is no problem or there is no fear of contamination or recontamination. And we have evaluated the Aclosop respiratory powder, this Aclosop powder by means of different ISO standards, like ISO 17191 etc. And it's all all the studies is accepted dosage and the values data. And we also did a field trials for this particular canister bag in a neuro ICU at our hospital, Sri Chitra Tirunal Institute for Medical Sciences and Technology. And also we check with the Anandapuri Hospital in Thiruvananthapuram, and some of the studies in KIMS Hospital and the medical college is also going on, so that we can confirm that this will be useful for different contagious secretions, to decontaminate different secretions in patients, like in the case of patients with HIV or patients with the TB or the COVID. Actually, it's already gone, so now we don't have a fear of COVID. So definitely we have to see that means how we can extend it, the application of this particular product. So that is when we tried to do many field trials with different disease conditions. So, and that is in most of the studies that shows that means it's highly acceptable, and it's highly feasible to use in this system. So you can see that that is the yellow canister that is attached to the wall, and we can just insert this canister bag in the canister. And once this canister is full, we can see the marking and all, so that we can stop, we can open it and take it out and seal it and discard it. So it's the field style trial we have done at Sri Chitra Tirunal Hospital, and our nursing staff and all staffs are very supportive in confirm the usability or feasibility of this particular product. And we also transfer this technology to Romson Scientific and Surgical Private Limited. It is an international company. It has multiple branches in all over India and outside India. So now we are means they already have means manufactured like 2,000 bags, and now we are seeing that it should be in the market for all of us to use. So we are still waiting for that. And with this, I stop this. If you have any questions, means I'm happy to answer. Thank you.
Thank you, ma'am. Now it's time for open discussion.
Thank you, ma'am. Thank you for the very informative talk. I have a couple of doubts. Like it was an interesting talk on nanogels where the glass transition is decreasing, isn't
The
it?
glass transition temperature of the base matrix is decreasing while adding the nanogel.
So just a doubt, ma'am, what will happen to its mechanical strength?
That is what I showed, the rubbery modulus, that is at Tg plus 40 degrees Celsius.
Okay,
Actually, the rubbery.
tensile properties is also
But
improving.
no, the property will decrease.
Yeah, that.
So definitely means while you are while we are adding a plasticizers, the flexibility of the system is increasing, and definitely that the mechanical properties will reduce. But there means we don't need that much strength for that particular application. Even for the soft liners means maybe, or blood bags, if you see, means definitely the mechanical properties of the blood bag and the PVC pipes is the same material with a different concentration of plasticizers in it. So the mechanical properties of the PVC is very high, but in the case of blood bag, definitely low. But for the application, for a particular application, we need that plasticizing effect, but we should have a optimized mechanical properties, but there should be an optimization.
What about the samples when you added 20% of plasticizer? That was also showing very good, like your available tensile strength.
While adding the 20% of plasticizers, the TG is coming to 25 degrees Celsius from 60. But the rubbery modulus of the system is reducing to 10 from 23.
Okay,
So almost like a 50% reduction. But when if we are thinking about the application, for example, in the case of soft liners or for the blood bag, that mechanical property is still good enough, because even if you look into that, is still in MBA megapascal.
Yeah,
So
yeah.
it's a good enough for that particular application. So it is all we have to optimize the composition based on the application.
So another doubt, ma'am, what is the operating temperature of the systems that you're the bags, or is it around 25 degree, or is it very less?
So which operating
Like
temperature?
when we are storing the.
So, for example, in the case of blood bag, I will say, because it's a we can relate, because we usually see this blood bag. So in the case of blood bag, means usually we store it in cold temperature. If it is blood is collected, we will store it in cold temperature. Otherwise, we will store it in room temperature only. So it is like means TG is like means at TG should be in such a way that at room temperature it should be flexible. For example, in the case of 25, means while we are adding 20% of nanogel, it's reducing to 25,
Yeah.
the TG. That means at 25 or at room temperature, in our scenario, it will be like 28 or 29, whatever it is. So at that room temperature, it is flexible. It is more flexible, and that is suitable. So it is all depends upon the what is the storage condition, what is the condition at which the material is using. All that matters.
So it can sustain our climatic conditions.
Yeah, definitely. And if you want to, we can just modify a little bit. Actually, here, we use the nanogel with a TG value of -31. That is why this much drastic change.
Yeah,
If
I
you
understand.
don't want and if you want to introduce some mechanical properties, we can modify the system accordingly. And the whole system also we can modify so that it will be suitable for that particular applications.
Yes, ma'am. Thank you. Another interesting thing in your presentation was that the contact angles were decreasing. That means it was showing some hydrophilic character. Yeah, but the water uptake was, decreasing due to cross linking. So that was a very really good
It's like a
observation.
contradictory.
Yeah,
Like
yeah, sure.
basically, it's a contradictory. The equilibrium water content is also showing the hydrophilicity of the matrix, and the contact angle is also whether it is hydrophobic or hydrophilic. That is the indication that we are getting. But the equilibrium water content is a bulk property. In the case of contact angle, it's like a surface property. So in the since we are introducing the reactive nanogel, so that it's like here also means it's a thiolene because the nanogel is thiol functionalized and the matrix is acrylic. The exothen whatever we are using as a base system is acrylic in this case. So we can use different methods or different chemistry. So here actually it's acrylic. So the thiolene based Michael addition reaction is happening. So, and some cross-linking is also because there are multiple functional groups in a single system. So the cross-linking is also happening. So maybe because of that, it's having, and also means if you see that means while we are introducing the nanogel, the viscosity of the system is also increasing. So that it will polymerize very fast compared to the base system. So um, including altogether the cross-linking density is since it is increasing slightly and there is not much difference. So if you can see the standard variation and the significance is very it's not maybe I have to check that's
No, ma'am, we also had similar contradictory observations while we were dealing with biomedical textiles.
uh,
So actually, I was very curious to know.
So
Like,
actually, in this case, it may be because of the cross-linking. As the cross-linking increases, that the equilibrium water content means the uptake is also definitely based on the cross-linking and all. So that may be because it's slightly reducing. But since we are using a thiol functionalized nanogel, while we are incorporating it in the polymer matrix, that thiol free thiol group will also be introduced on the surface. The possibilities are there.
yeah.
So because of that hydrophilic thiol group, that the contact angle is reducing with increasing the concentration of nanogel. So
Okay.
definitely it's a contradictory, but we can define in such a way.
Sure, sure. Okay,
Because
thank
it's
you.
a consistent because we tried because while we are also looking it's like a contradictory so we tried I mean in different aspects to see that it's to confirm that data.
Okay, ma'am. Thank you.
Yeah.
Thank you, ma'am, for the nice presentation.
Thank you.
So, ma'am, can you take the reaction that you have shown?
This reaction or the other one?
No, ma'am, the first one. So I'm having a doubt whether is it any role of that sulfur in this particular reaction because you have deliberately taken thiol.
Yeah, that is what I'm telling. This is based on a thiolene-based Michael addition reaction. Thiol-ene, thiol and
Yeah.
double bond. That's like a thiol. Enamine reactions are there, na? So you're from the chemistry, na?
Yes, yes.
Yeah. So like enamine reaction, the thiolene reaction is also possible.
Okay.
That's also a feasible reaction. So here we are having that chemistry.
So
we
is
are
it anything to
introducing.
do with any kind of hydrogen bonding? Because usually we see with OH. So if you replace OH with SH, means like since you are saying that it should be like hydrophilic and all. So is it anything to do with the incorporation of sulfur in terms with its hydrophilicity or even hydrophobicity?
So here actually we used so that we can have this particular reaction that's a thiolene based reaction and also like hydroxyl group it will also introduce the hydrophilicity to the particular systems.
Okay, so this
So
reaction pathway that
and here actually in this particular application we don't need a hydrophilic material anyway.
okay. So this reaction pathway have been designed by you people only.
Yeah, definitely. Yeah.
Okay.
And here actually the good thing is that means compared to actually we have like a multiple reaction chemistry we tried like a free radical solution polymerization simply with the acrylic systems, and by using the different high compositions of chain transfer agent we control the size and the cross-linking density and all that things. And in this case, but there the problem is that it's a very fast reaction. The controlling is very difficult. The polymerization will also means if we don't have the control, it will undergo macrogelation. So we don't will get, we will not get the nanogel nano format. We
So
will
you
not.
can limit the molecular size.
Yeah, and in this case, actually, the good thing is that it's like a step growth reaction.
Okay.
It's a Michael addition reaction, is step by step reaction.
Yes, yes.
So,
So you can control.
yeah, we can control actually. So that is the good thing about this thiolene based polymerization system.
Okay, ma'am. Thank you. Thank you.
I appreciate you for the very wonderful
Thank you so
talk,
much,
Dr.
ma'am.
Manju. So I just have a simple question because here you have all thiol moieties, the outer surface. Have you tried with any other hydrophilic moieties or any other functionalities? And can you correlate that with the cytotoxic studies that you have
The
did?
cytotoxicity of the system is still like a 10 percentage. There is no till a 10 weight percentage. There is no toxicity, and this is with L929 mouse fibroblast cells. We have to check with other cell lines. That
Okay.
is based on the application. Because if you're for the blood bag, we have to use, and for this means adhesives or denture soft liners, we have to use the cells accordingly. And to answer your question, means yes, ma'am. So we tried different nanogel compositions. So basically, with acrylic free radical solution polymerization with tertiary butyl acrylate and PEG polyethylene glycol dimethacrylate composition at different weight, molecular weight of PEG that we used, and see that how the molecular weight of the polyethylene glycol have effect on this nanogel and its plasticizing effect. And also we tried with the IBMA, isobutyl methacrylate, isobonyl acrylate, sorry, isobonyl methacrylate and urethane dimethacrylate system. And but in the case of isobonyl acrylate and urethane dimethacrylate system, that is the free radical solution polymerization. Only the acrylic groups are there, and using ABN as a catalyst. And we control the reaction and control the size using high concentration of chain transfer agent, that is mercaptoethanol. And also we use the combination of mercaptoethanol and mercaptosuccinic acid. But mercaptoethanol is giving very good effect actually for controlling the size. And actually, but in the case of free radical solution problem polymerization, the main problem is that controlling the reaction is very difficult, because sometimes it will be completed within like half an hour, sometimes it take like 4 hours, 2 hours. So we have to frequently monitor the reaction mixture to see that where we stand.
Normally, what's the reaction duration?
That is what it depends upon the composition. In some of the systems we completed means the reaction was completed within like 30 minutes. In some reaction like 2 hours, 4 hours it took. But in the case of TBA pegdema, means at pegdema of molecular weight 750, means the reaction time was around 4 hours. But as the cross-linking means the molecular weight of the cross-linker, that is dimethacrylate, we tried with the 3000 molecular weight, 5000, 8000, and 20,000 molecular weight. So there is slight variation is happening. So because as the molecular weight of the cross-linking agent increases, means the cross-linking density is also coming low, and there is some changes actually, so that the time is also going extending. So maybe we have to see means why it is
Yeah, there are
actually
a lot of
extending. Yeah,
parameters to be
so
checked out.
we have to optimize definitely. But definitely, we tried with the different functionalities, especially the acrylic and tile-based system. And also we can use like a enamine reaction for this particular case. But thiolene reaction, why we use? Because so my lab is mostly concentrating on the dental biomaterials. Definitely, we are working on other studies also, like how we can introduce this nanogel plasticizers in blood bag, and also some other studies like a biodegradable micro beads for TAC, that is transarterial chemoembolization studies. Also, there are different other studies, but mainly, actually, since it is the division of dental products, our main scope is the dental. So this thiolene system has a very good advantage because of its step growth polymerization. It have low. It will introduce a low shrinkage stress and volumetric shrinkage. So that is huge in especially in dentistry. So that is why this the importance of thiolene. So we are just seeing means how we can extend that application in different things. Actually, the same the nanogel additives we use to introduce to improve the mechanical properties of the glass ionomer cements also. But that is the mechanism is generally different. But in the glass ionomer cements, we are using polyacids and glasses. So the polyacid is having a large number of carboxyl groups. So there is a possibility of intermolecular, intramolecular hydrogen bonding, and these carboxyl groups will not be available for reacting with the glass particles. So we have to see that while we are introducing this nanogel, because it will definitely exchange the interaction. So we can reduce the intermolecular hydrogen bonding, and that way means we can increase the interaction between the glass and the polymer. And so actually that works actually. So that is one of the SERV project. It's already completed. So yeah, yeah, ma'am. Thank you.
Thank you. Thank
I
you.
think I answer your question, is it, ma'am?
Yes.
Yeah. Thank you. And thank you so much, ma'am, for inviting me for this presentation. It's a nice experience. So I'm really thankful.
Thank you, ma'am. It was an interesting talk. I have some doubts, ma'am. If
Mm.
I'm wrong, please correct
Oh,
me.
yes.
So, in this synthesis of this nanogel, you have used the exothane 9 itself, and after that, it were incorporating in exothane 9.
Mm.
Like exothane 9 was the matrix.
Right.
So, can you please explain why did you choose a
So actually, as there are, as in the earlier slide, I showed you that means the compatibility of the plasticizers and the metrics is an important factor to mitigate the migration and the leaching. So here also, in order to introduce that compatibility, we use the same system to making the nanogel also, so that it will be that two factors will come together. So that is the logic in using the exothane itself. But it's like around 30 percentage mole percentage, 30, 30, and 40. That is the ratio that we have used.
concentration is less?
30 percentage. I will not say it's a less.
Yes.
It's one by third, almost one by third.
Can you explain why did you choose a that photo curing process? I think it is photo curing process you have followed, right, ma'am? Or
Yeah.
why you want for a photo curing, whether it is choosing
Photo
that
curing
generally
for
for exothane.
so photo curing for film.
Yeah, yeah.
Yeah. So mm, so for photo curing, we can use any curing techniques like a photo curing or thermal curing, but the photo curing is like it's like very good compared to the chemical curing. We will get our own time for before polymerizing. Means it's like a what we say. We have it's like a tailor made, something like that we can say. But in the chemical cure, while we are mixing the two components, in most of the case the chemical cure is like a two component system. While we are mixing together, it's polymerized. And we don't have any sufficient time. But here after mixing, we have to expose light, then only it polymerize. So we will get our own time. And especially because while in dentistry, actually we use this photo curing. That is the most effective one, because the dentist will get sufficient time, because they have to expose light, then only the polymerization will happen. So we are getting our own time for reaction. It's like it's controllable. But in the other case means while we are mixing, it's polymerized. Whether we made it in the proper format or not doesn't matter.
Ma'am, so there is no need of an external curing agent for this reaction. That nanogel itself is like a curing and highly cross-linked network we will get after this.
External curing agent
In
means
some film fabrication, we may use some curing agent additionally than the plasticizer or fillers. So,
Mhm.
is there any need of No need, right?
For this particular case, we are using IrgaCure as the catalyst, photocatalyst.
Photocatalyst.
At 395 wavelength, if you are exposed, it will polymerize. And the nanogel itself, here actually for this particular application, since we are using the nanogel as a plasticizer, we don't need any filler or any other material. The curing material means it's like a acrylic system, maybe like means like dimethacrylate or whatever it is, multifunctionalized polymer. That is what the curing material that you mean. No?
Yeah, yeah.
So here actually the exothane itself is a dimethacrylate. So it's like a urethane extended peg dimethacrylate. So itself is that the crosslinker is there actually. The base matrix is itself is crosslinker. But for example, if you are using PMMA, the nanogel is using in the PMMA matrix, then definitely we need a cross-linking agent so that we can make a cross-linked network. Definitely nanogel will introduce some cross-linking, but that will not be good enough if again it is application based. What application we are looking for? If we need a highly strength material, then definitely. Otherwise, it's all application based. Means when we are going for any chemistry or any composition, when we choose based on the application, we have to choose. So, for example, in the case of dental or bone cement or whatever it is, maybe that cross-linking agent is the curing agent is also needed, along with the fillers and all. Means it's applicable when we are going to introduce the mechanical properties. But here actually rather than mechanical properties, we are introducing the plasticizing effect, the flexibility to the polymer material, so that
Absolutely.
even at room temperature means it will be flexible and good enough for particular application.
One more doubt, ma'am. Did you check the FTIR or some kind of characterization of the film which you have prepared?
Yeah.
Because you were telling about the hydrophilic characteristics of the film. So
Mhm.
that if we know that functionalities in it, we may can explain how this hydrophilicity happened. So whether you have checked the characterization FTIR for the films?
So FTR actually rather than checking the spectra, we check the conversion of the film, because the spectra means here we are not looking for any because it's all added and we made the film by curing, we made the film, and now we have to check that means whether the curing is happened, 100% curing is happened. If there is no 100% curing,
Or maybe some
yeah,
functionalities over, so it
yeah,
will be hydrophilic.
yeah,
Yeah.
actually here actually in this particular graph we are looking for the 814 peak only. So we
814.
have to see that whether the acrylic conversion is happened, and once
That's
the
one for
acrylic conversion is
nanogel, man. Nanogel.
here
Here also.
also the
Okay,
same
okay.
thing, na?
Okay.
So if you look into this particular system, it's a diacrylate system, and the nanogel is also having thiol group. So the thiolene reaction will happen at the same time. The acrylic polymerization is also happening.
Thank you, ma'am.
Yeah.
Thank you. Thank you for
Yeah.
clearing my doubts.
I'm delighted to express our collective awe and gratitude for the truly exceptional presentation. The depth of your insights, the meticulous research, and the innovative solutions presented were nothing short of extraordinary. We are sincerely thankful for sharing such invaluable knowledge with us. Thank you, ma'am.
Thank you so much.
As a token of our love and gratitude, we would like to honor our distinguished guest, and I request Professor Seena S. Pillai, Department of Chemistry, to honor our guest.
Now, we will be having a short tea break and we will be resuming the next session from 11:45.
Hello, Stanimir, can you hear me?
Yes, I can.
Okay,
Hello.
yeah, yeah. We are maybe running like 2 to 3 minutes late. We are having this tea break.
No problem. I
So
heard that. Yes.
yeah, so please be online, and
I am
then
online. Yes.
yeah, I'll call you again like once the crowd is back to the auditorium.
Okay, no problem.
Yeah, thank you, Stanimir. Thank you.
No problem. I'm here.
Hello? Stanimir, can you hear me?
Yes.
Can you please turn on your video? So we'll start with the talk. So there will be a brief introduction and then maybe you can start with the,
Okay.
yeah, please turn on the video.
Can you see my screen?
Yes, sir. Continuing our exploration of groundbreaking research, we have Dr. Stanimir Manlov from the University of Plovdiv, Bulgaria. To extend our warmest greetings to Dr. Manlov, I invite Mr. Sumit Satyendran S., Assistant Professor, Department of Chemistry, to join us on stage.
Om Amaveshe Namaha. A very good morning and welcome to the third keynote talk on today's session. And it is indeed a great pleasure to me to introduce Dr. Stanmir Malnov to ICMSC 2023. And Dr. Stanmir Manlov is a Chief Assistant Professor of Organic Chemistry at the University of Plovdiv, Bulgaria, and he earned his BSc in Computer Chemistry in 2008, followed by his MSc in 2009, culminating a PhD in Organic Chemistry in 2015, all from the esteemed University of Plovdiv, Bulgaria. And his academic journey has been marked by a fervent exploration of eco-friendly synthesis and the foundation principle of green chemistry, with a specific emphasis on pioneering innovative synthetic methods utilizing heterogeneous catalysts. Dr. Malnov's research extends to realm of profane hybrids, a distant class of compounds renowned for their potential applications in the pharmaceutical field. His work in the domain intricately weaves together precise in vitro biological assessment and cutting-edge to silico calculations to craft and refine compounds with augmented biocavity. With an unwavering commitment to sustainable chemistry practices, Dr. Malnov actively contributes to the advancement of environmentally friendly process for synthesizing biologically active compounds. With this brief introduction, on behalf of organizing committee, I welcome you to sir to ICMSC 2023 and to deliver the talk on the topic employing mechanochemistry in organic synthesis for obtaining biofunctional hybrid molecules. Over to you, sir.
Thank you, Dr. Sumit.
So good morning to all of you. I hope you can see my presentation and you can hear me well. Can you hear me well?
Yes, sir.
Great. Okay, dear ladies and gentlemen, dear colleagues, I'm deeply honored to stand before you today, albeit virtually, as we gather from different corners of the world to celebrate the fascinating world of chemistry. While we may be physically distant, our shared passion for this field unites us in a common purpose to explore, learn, and innovate in the name of science. I would like to express my gratitude to the conference organizers for their exceptional work in making this event such a success. It's a real honor to be part of this gathering of minds. I'm delighted to be here today to discuss a topic of great scientific significance. Our focus is on employing mechanochemistry in organic synthesis for obtaining biofunctional hybrid molecules. Over the past few decades, the landscape of scientific research has witnessed a remarkable transformation in the realm of green chemistry. From 1990 to 2024, there has been an astonishing surge in the number of articles published in scientific databases dedicated to this eco-conscious field. This exponential growth not only reflects the increasing awareness of environmental sustainability, but also signifies the dedication of scientists, researchers, and institutions worldwide to explore innovative solutions that reduce the ecological footprint of chemical processes. The wealth of knowledge and discoveries generated during this period underscores the global commitment to fostering a greener, more sustainable future for all of us. As we navigate this ever-expanding sea of green chemistry research, we continue to be inspired by the collective effort to mitigate environmental impact and pave the way for more eco-friendly and responsible scientific practices. This journey from 1990 to 2024 serves as a testament to our commitment to a more sustainable and harmonious coexistence with our planet, of course. The journey of mechanochemistry, a field where mechanical force transforms chemical reactions, has been a fascinating one as well. Beginning its scientific odyssey in the 1960s, it made slow but steady strides in research publications until 1992, and then the pace accelerated, and today in 2024, it's a dynamic and ever-evolving landscape. From its humble beginnings, mechanochemistry has grown into a vibrant and thriving discipline with a significant surge in research output over the past few decades. The rise of articles related to mechanochemistry signifies the growing recognition of its potential to revolutionize chemical synthesis and its impact on diverse scientific fields. In this presentation, I'll discuss green chemistry, mechanochemistry, and acid catalyst. Of course, I'm going to share some of our late research. Green chemistry promotes eco-friendly processes. Mechanochemistry explores reactions driven by mechanical force, and acid catalyst enhance reaction efficiency. I will also share some of our latest findings contributing to these fields. Mechanochemistry has a rich historical legacy with applications dating back to ancient times, serving to enhance living conditions through processes such as crafting ceramics for pottery and refining metals for various applications via mechanical treatments. Early forms of mechanochemistry were instrumental in producing the first inorganic materials, pigments, and pharmaceuticals, all achieved through the fundamental practice of grinding. In 1966, a significant breakthrough occurred with the development of mechanical activation as a powder preparation technique, enabling the creation of uniform products from elemental powder mixture. Since then, ongoing research has unveiled a multitude of applications for mechanochemistry in the realm of minerals, inorganic compounds, and polymers. Mechanical activation in particular has proven invaluable in expanding solid solubility limits and generating novel phases with finely dispersed and smaller grain sizes. This versatile technique has opened up possibilities for diverse phase formations, including amorphous crystalline and quasi-crystalline structures, all, of course, achievable at low temperatures and in scalable processes. The term mechanochemistry made its debut in scientific literature in 1919. According to the International Union of Pure and Applied Chemistry, mechanochemical synthesis is defined by a chemical reaction initiated by the direct absorption of mechanical energy. Mechanochemistry encompasses various mechanosensitive transformations, including compression, shear, and friction. These mechanical processes, such as grinding, milling, shearing, sliding, or plastic deformations, act as catalysts to trigger reactions, with their outcomes being subject to the heat released. The exploration, utilization, and continual advancement of this method have been of paramount importance in the field of mechanochemistry, spanning from its historical origins to its contemporary applications. In the mechanochemical synthesis, chemical reactions are excited by mechanical energy. It is principally supplied from hand grinding and mechanical milling without the need of bulk solvent. Hand grinding or manual grinding is generally applied by a mortar and pestle, and it is the simplest way for the generation of mechanical energy. For mechanical milling, a shaker, bowl, or mill have generally used at various frequencies, for example, from 5 to 60 Hz. The disadvantages of hand grinding are open and sensitive to environmental factors, while mechanical milling presents an enclosed solvent-free medium. The other advantages of milling do not require any physical effort and greater power allowed further systematic researches. The mechanical energy is obtained from grinding and milling that affects an enlarged crystalline solid, like heating, decreasing particle size, increasing surface area, fabricating new interfaces and crystal defects, removal of passivating layers, amorphization, and the formation of metastable polymorphs. In 1967, Thiessen introduced the magma plasma theory as an attempt to elucidate mechanochemistry. This theory posited that the application of mechanical energy led to the creation of numerous excitation states, each with distinct relaxation times. The magma plasma theory in the context of mechanochemistry is a somewhat abstract and theoretical concept. The theory attempts to explain the phenomenon of mechanochemistry, where chemical reactions are initiated and driven by the direct absorption of mechanical energy, typically in the form of mechanical stress or mechanical milling. The theory posits that when mechanical energy is applied to a substance, it induces a variety of excitation states within the material, each of which occurs at different relaxation times. In other words, the mechanical energy input leads to various forms of internal energy within the material, and these energy states may persist for different durations. This energy transfer and state transitions are to be crucial in initiating and sustaining chemical reactions under mechanical action. While the magma plasma theory provides a conceptual framework for understanding how mechanical energy can lead to chemical reactions, it's important to note that it is a theoretical model and doesn't describe specific mechanism in detail. The theory helps illustrate the idea that mechanical energy can induce complex and diverse reaction within materials, making it an interesting concept in the field of mechanochemistry. Following this development, a variety of approaches and models were employed to elucidate the mechanisms and kinetics of mechanochemistry. Among these, one notable method involves eutectic melting, and the occurrence of submerged eutectic temperatures below room temperature facilitates the formation of co-crystals. Additionally, dissolution in a small quantity of liquid introduced during the co-grinding gas-solid reactions resulting from sublimation and direct solid-state interdiffusion of components are among the other techniques utilized in mechanochemistry. However, a common challenge with these methods lies in the use of intermittent mechanical pulses, resulting in disparities between the total time and the actual time of mechanical treatment. Kaup has proposed a model to clarify the mechanism underlying mechanochemical milling, involving three fundamental steps. The first one is the diffusion of reactants through a mobile phase leading to a chemical reaction. The second, the nucleation and growth of the product phase. And the final one, the separation of the product to expose fresh reactant surfaces. Currently, mechanical activation and alloying are emerging technologies for producing high-value products. Mechanical treatment has become an alternative technique in the realm of green chemistry, offering environmentally friendly options with or without solvents. Various milling parameters, of course, play a crucial role in optimizing reaction conditions and influencing the performance of mechanochemical reactions. These parameters include milling types, such as shaker, planetary, ball mill, and treater, the choice of milling materials, vessel, jars, bowls, and vials, milling size, the ball to powder weight ratio, vial filling, the number of balls, milling time, temperature, atmosphere, rotation speed, frequency, and the use of process control agents. Each of these factors has a direct impact on the kinetic energy of the milling balls and consequently on how mechanochemical reaction unfolds. Different mill types, such as shaker mills, planetary mills, attreaters, and uniballs, were reported to be used in the literature. Of course, their capacities and speed differ from each other. They check the process by varying the milling temperature and minimizing contaminations. The most used milling types are shaker and planetary mills. The shaker mills are applied to shake small samples, while planetary mills are used on the industrial scale for sample processing and colloidal grinding. The planetary mill is an effective method with good reproducibility and reliability. In shaker mills, rapid side-to-side motions were shown in a reaction vessel. The planetary mills have pots that are connected to disk and rotate around the center of axis, as is shown in this uh, picture. The large strike energies of milling balls inside the pots that increase the efficiency of grinding were formed through the high rotational speed. In general, the milling materials for all these vessels, jars, bowls, and vials are tungsten carbide, stainless steel, tempered steel, zirconia, corundum, agate, silicon nitride, chromium steel, chromium nickel steel, and plastic polyamide. Some of them are naturally occurring porous materials. The stainless steel is widely applied in short milling, and zirconia is generally selected in long milling to avoid metal contamination. The higher density can cause higher energy transfer, and in conclusion, the product yields can be increased, of course. The milling size directly changes the surface properties of the synthesized materials. The large or high density balls can supply high collision energy and increase the surface activity that causes forming the thermodynamically stable products. The small balls increase the frictional action that helps to form amorphous and metastable phases, and they are generally selected when, if more efficient mixing is required. The ball to powder weight ratio has been a crucial parameter as well that correlates with kinetics. This ratio can be changed from low values as 1 to 1 to high values as 220 to 1. At the high ratio, the number of collisions increases and more energy transfers, more heat originates, and so mechanical activation takes place much faster. By changing these parameters, novel materials that have these desired physical, chemical, and optical properties have been produced. The milling ratio of the vial is another significant parameter due to the need for enough space for moving freely in the container. When the amounts of balls and powders have been small, the production rate has also been small. If the amounts are large, not enough gaps fine to move and the energy affects much more less. For this reason, 50% of the vial space must be empty. The milling time has increased the yield of the reaction because the collision numbers and the total amounts of transferred energy have also increased. In some cases, the product can be decomposed due to the increment of contamination and the formation of undesirable phases with long milling time. The milling time has also changed the morphology and mechanical properties of the product. Uh, the revolution speed must be minimized to obtain the desired product with high yields and quality. The results of more powerful mixing and the increasing number of collisions, the revolution speed increase and the energy input increase, higher yields and better substrate conversion can be obtained. High speeds may cause byproduct formation, or the increasing temperature may cause the decomposition of the metastable phases. The temperature increase can be useful if diffusion is required for powder alloying. The lower revolution speed causes less energy consumption, lower cost, and more energy efficient. The milling temperature is also an important parameter for mechanochemical synthesis, and to increase the temperature, to decrease the temperature, liquid nitrogen can be used on the milling container as well. If we would like to increase the temperature, electrical heating can be applied in the milling vial. Temperature changes directly affects the solid solubility levels and phase formation. The rotation or oscillation frequency affects the yield selectivity and similar properties of the reaction according to the kinetics of the reaction. If the frequency increases, side reactions occur, and this negatively affects the yield. The milling atmosphere is another important parameter. The inert atmospheres, helium and argon, are widely used to reduce contaminations. Nitrogen atmospheres can be used to form nitrates. Hydrogen atmosphere can be applied to form for hydrate formation. If the powders are reactive, both oxides and nitrates can be produced in the air atmosphere. The lubricants and surfactants can be utilized as a process control agents to minimize the effect of cold welding between powders and prevent agglomeration. When the surfactants absorb on the particle surfaces, interfere with cold welding, the surface tension decrease. Benzene, silax, dodecane, paraffin, stearic acid, sodium chloride, boric acid, borax, alumina, etc., have been widely used as the process control agents, and during the milling process, they decompose and interact with powder particles and produce the compounds. The process control agents directly influence the final phase, the solid solubility and contamination levels, and the glass forming range. Photomechanochemistry finds diverse applications across numerous fields. In material science, it is used to synthesize advanced materials, including nanoparticles and polymers with enhanced properties. The pharmaceutical industry benefits from mechanochemistry in drug formation and co-crystallization, improving drug stability. In catalysis, it enhances reaction rates and selectivity, while green chemistry embraces it for its eco-friendly solvent minimizing approach. Materials engineering leverages mechanochemistry for creating high-performance materials, and battery technology employs it to enhance the efficiency of energy storage systems, from coordination chemistry to agriculture and waste remediation. Mechanochemistry is a versatile tool shaping the future of various industries. Mechanochemistry is a valuable tool in organic synthesis as well. It is used to create organic compounds and activate reactions while reducing the reliance on solvents and hazardous reagents. This environmentally friendly approach is particularly beneficial for solvent-free condensations, solid phase synthesis, and pharmaceutical compound preparation, making organic synthesis more efficient and sustainable. In the realm of organic chemistry, bone milling has proven to be an effective technique for various processes, including carbon-carbon bond formation, aldol condensation, asymmetric organic synthesis, amine condensation, the synthesis of heterocycles, enantioselective synthesis, and even the modification of fullerenes, all achieved under solvent-free conditions. Furthermore, within organic synthesis, mechanochemistry has found wide-scale application, primarily through the use of mixer mills and planetary mills, while still maintaining solvent-free condition. Research on the practical use of the intermolecular alpha amido-alkylation reaction has been ongoing for numerous years in the Department of Organic Chemistry at our university, University of Plovdiv, Paisi Helendarski. During this time, researchers have identified the optimal conditions for this reaction, specifically the presence of electron-donating substituents within the amide molecules and the acidic reaction medium are critical factors for the reaction's successful progression, notably for amides lacking electron-donating substituents in their aromatic core. The intermolecular alpha-amido-alkylation reaction becomes feasible only when employing a more acidic environment. The alpha-amido-alkylation reaction greatly broadens the scope of the Pictet-Spengler reactions application. This reaction results in the formation of products with a newly established carbon-carbon bond positioned alpha to the amide group. It serves as a valuable substitute for the Mannich reaction and notably extends the range of synthetic possibilities for the Pictet-Spengler reaction. The final products of this reaction are 1, 2, 3, 4 tetrahydroisoquinones, and we can vary the substituents in order to obtain different nature derivatives of this skeleton. As I said, isoquinoline alkaloids form a substantial and continuously expanding category of biogenetically connected isoquinoline compounds discovered in numerous plant species owing to their diverse pharmacological and biological attributes. Several of these alkaloids are presently employed as therapeutic agents for a wide range of medical conditions. Combining the isoquinoline skeleton to fluoroprofen makes a new biofunctional hybrid molecules, which are interesting regarding their biological activity. In blue color is given the 1, 2, 3, 4 tetrahydroisoquinoline skeleton, and with the red color is given the fluoroprofen unit given in the in your presentation on the right side. Fluoroprofen is a well-established non-steroidal anti-inflammatory drug from the profen family. Is widely prescribed for the treatment of rheumatoid arthritis and various other inflammatory conditions. Medicinal chemists credit fluoroprofen's exceptional biological, pharmacological, and pharmaceutical attributes, as well as its relatively reduced side effects compared to some of the other profen counterparts, to the presence of fluorine atom within the molecular structure. This fluorine atom possesses a unique combination of electronegativity, size, and lipophilicity, making it invaluable in research aimed at discovering and modifying drugs already in medical practice. Its comparable size allows the fluorine atom to effectively mimic a hydrogen atom or a hydroxyl group in terms of spatial requirements within receptor sites. Additionally, its strong electron accepting properties make it a powerful tool for modeling factors such as Ka and electron density in aromatic systems within the molecules. These characteristics significantly influence binding affinity, distribution coefficient, solubility, permeability, protein binding, and pharmacokinetic properties. The remarkable properties of fluorine have positioned it as an essential and widely utilized element in molecular design. Since the mid-20th century, there has been a surge in the use of fluorinated compounds for medical purposes, exemplified by the multitude of fluorinated drugs available in the pharmaceutical market. Some notable examples include 5-fluorouracil, which is given here in the middle, an anti-cancer drug that inhibits DNA and RNA biosynthesis, and ciprofloxacin, an antibiotic belonging to the fluoroquinolone family, known for its enhanced tissue and intracellular diffusion compared to other quinolones. Uh, the fundamental principle of green chemistry involves leveraging chemical knowledge and expertise to reduce or eliminate the use of generation of hazardous substances in every stage of chemical processes, from design and manufacturing to application. This approach aims to minimize risks to both the well-being of operators and the environment as well. Consequently, the emphasis lies in preventing or reducing the production of toxic waste, prioritizing this over dealing with waste that has already been generated. In recent years, heterogeneous catalysts have gained significant prominence in numerous organic syntheses, thanks to their numerous advantages. In line with the principles of green chemistry and their intriguing reactivity, these catalysts seamlessly integrate into contemporary organic synthesis. Often, working with toxic, explosive, or harmful reagents becomes safer when they are applied in conjunction with a solid support. Regions supported on solid substrate typically exhibit distinct and often more selective reactivity compared to when they are used in their free and unsupported form. As I already mentioned, in recent years have seen increasing application of mechanochemistry as a solvent-free synthetic route for the preparation of heterocycling compounds. The method provides an environmentally friendly, safer, and more efficient transformation pathway with larger scale yields of the desired products. The importance of this method is the scalability of the reaction, even without mass dissolution of the reactants. The adoption of such approaches bestows upon mechanosynthesis distinct advantages over traditional synthetic methods, primarily in terms of superior selectivity and the ability to facilitate previously inaccessible reactions. Recent years have witnessed a growing number of these mechanochemical processes, as I mentioned earlier, aimed to generating pharmaceutical relevant fragments and functional intermediates. Today, modern mechanochemistry has found its place in pharmaceutical chemistry, known as pharmaceutical mechanochemistry. This specialized field focuses on the environmentally conscious production of active pharmaceutical ingredients and pharmaceutically relevant fragments through pharmacochemical methods, contributing to a reduced environmental impact. Also, numerous mechanosyntheses have been established for active pharmaceutical ingredients, including teriflunomide, the top left compound applied in multiple sclerosis therapy, Ftivazid, the bottom left compound on the slide, effective against tuberculosis, axitinib, the bottom left right compound used in renal cell carcinoma treatment, nitrofurantoin, the top right compound, which is given an antibacterial agent, and dantrolen, in the bottom row in the middle, a skeletal muscle relaxant. Mechanochemistry is increasingly recognized as an environmentally sustainable addition to organic chemistry, enabling various reaction transformation. It does so by eliminating the need for organic solvents and reducing energy consumption while aiming to construct a diverse array of synthetic and natural products. Drawing from the assessment of the potential biological activity in the target compounds and the pursuit of novel, eco-friendly synthetic approaches, the study set out to achieve a specific objective: the utilization of this catalyst supported on silica within a mechanochemical context to produce nitrogen substituted 1,2,3,4 tetrahydroisoquinolenes given in the scheme. In pursuit of this objective, the research aimed to address several key tasks, which include identifying the most favorable conditions for a mechanic chemistry assisted intermolecular alpha methylation reaction, focusing on aspects like reaction duration, the quantity of heterogeneous catalysts employed, determining the optimal conditions for the isolation of the reaction product with the highest possible yield and, of course, purity. In the quest for appropriate reaction conditions to facilitate the chemically assisted intermolecular alpha hydroxylation reaction for the synthesis of 1,2,3,4 tetrahydroisoquinoline hybrids incorporating fluoroprofen, a series of experiments was conducted to identify the optimal reaction parameters. This initial unsuccessful endeavor to perform the reaction in a mortar and pestle prompted a shift to employing a ball mill. So mechanosynthesis was conducted from our group using a ball mill vibrator model Narva Esbisdorf, working with the working chamber of 4 milliliters, and the synthesis utilized two metal balls, each measuring 10 millimeters in diameter and weighing 4 grams. In the quest for optimization, we initiated the process by varying the quantity of the polyphosphoric acid on silica catalyst. All reactants, starting amide 2, previously obtained from our group, paraformaldehyde, and this catalyst, polyphosphoric acid on silica, were combined within the ball mill container. The catalyst amount was systematically adjusted, ranging from 0.06, here is given in blue, to 0.6 gram, specifically 0.06, 12, 18, 0.24, 36, 45, and 0.6 gram, as indicated in here. Next to the reagents and catalysts, two metal balls were placed and the container was securely sealed to initiate ball milling. Under these conditions, encompassing the catalyst quantities of 0.6 to 0.45 grams, along with the experiments using pure silica gel, no observable reaction progress was recorded over time. That's why I give them here in red. It was only when a 0.6 gram of quantity of the heterogeneous catalyst was employed that a complete and noticeable reaction took place, with reaction progress evident in all cases. Following the reaction completion, the resulting powdery reaction mixture was transferred into a flat-bottomed flask and dissolved in dichloromethane. The mixture was then transferred to a separating funnel and washed twice with water. The organic phases was subsequently dehydrated using anhydrous sodium sulfate, and the solvent was distilled off. In addition to utilizing a solvent-free ball mill approach, the synthesis of hybrid molecules 3 was effectively achieved by conducting an intermolecular alpha-methylation reaction. This reaction was carried out using conventional heating at 80 degrees, with the reactants dissolved in dichloroethane and in the presence of heterogeneous acid catalyst, specifically polyphosphoric acid on silica, but 0.06 grams. The resulting yield and reaction durations for different examples are detailedly given in table 1. A noticeable reaction occurred in all instances, and the reaction duration varied depending on the specific starting amide 2, which is used. The shortest reaction time was observed within amide 2D, characterized by the presence of two electron-donating methoxy groups within the benzene nuclei. This conductive configuration facilitates the complete cyclization in just for 15 minutes. On the other hand, the transformation of amide 2C and 2F took a longer time, up to 2 hours, as we can see, to achieve full conversion. This variance can be attributed to the fact that in compound 2C, the site of the new carbon-carbon bond formation is located meta to the methoxy group in the benzene nuclei of 2-phenylethylamine. In the case of compound 2F, the presence of the weakly deactivating benzene nuclei substituent, chlorine, contributed to the extended reaction time. Taking into account the research carried out in this study and insights from the existing literature, we can recognize several merits that highlights the value of mechanosynthesis as an invaluable asset in the domain of organic synthesis. These advantages are encompasses minimizing the utilization of solvents in the production of different organic compounds, diminishes the potential for generating volatile and harmful substances, while also reducing the inhalation risk associated with solvent vapors. The efficiency achieved through intensive mixing and grinding overcomes the limitation of reactant transport in the solid state, resulting in the substantial reduction in the reaction time. This approach also minimizes solubility issues when working with hydrophilic and lipophilic compounds, and because of the effective transfer of energy to the reaction mixture, bone meal reactants are known for their low energy intensity. Scaling up reactions becomes feasible, enabling a shift towards continuous grinding and mixing. The concepts of economies of scale applies in this context here as well. The evidence present in both in the cases discussed in the literature review and the results derived from the research presented in this work unequivocally challenge the well-known quote attributed to Aristotle, no corpora nisi fluida, no reaction takes place in the absence of solvent. This research took place in Plovdiv University, Pisa-Helendarski, and was supported by project FP23 HF005, focusing on the topic synthesis application in silico and in vitro biological testing of new biofunctional molecules. I would like to thank for your attention, and also, if I have few more minutes, I would like to show who we are for this which don't know us. So this is our working group. On the left picture, myself, Professor Ivanov, and my colleague Dimiter. The laboratory is of organic synthesis and phytochemistry. And on the right picture is, I couldn't find not Christmas one. This is from last Christmas. Students which are involved in all of our projects. So this is our university, University of Plovdiv. The picture given on the right is our rectorate, and on the picture given on the left is our new building. Here I share with you some photos from Plovdiv. I'm not sure if you know that the Plovdiv is sixth oldest city in the world and is the oldest city in Europe. So this is our country. As you can see, Plovdiv here in the middle. This is our capital, Sofia. Our neighbors are Romania from the north, Serbia and Macedonia on west, Greece and Turkey on the south, and Black Sea on the east. So here where we are located, I gave this card so you can see here Amritapuri, India, and Plovdiv. It's a long distance. And thank you for your attention.
Thank you, sir. Now it's the time for open discussion. If you have any queries, you can ask.
Thank you, Professor. Thank you for your nice presentation. Can you comment on the prospects of this mechanochemistry in polymerization reactions?
Could you repeat your question? I couldn't hear very well. Excuse me.
Sure, sure. Can you please comment on the prospects of this process in polymerization reactions?
As I mentioned in my presentation, this mechanical chemistry way for synthesis, it's very popular in all the fields in chemistry. Of course, what we do is not polymerization. We use the mechanical chemistry for synthesis in new biofunctional molecules. And I'm not familiar with the use of polymerization reactions. I hope this answers your question, and please free to ask any other questions.
Hello, Dr. Sambanala. So it's very honored that we have listened to your presentation here. So I have, in terms of putting one question, a small question as a one query, for scaling up the product, whatever we are doing in synthesis, is this mechano chemistry will be helpful or in terms putting synthesis chemistry will be useful for scalable the product without changing its properties?
It's this is very useful way, a very good way in order to scale up the production. Of course, the need of using of much bigger bone mills, it's necessary. As you can see, our bone mill we use here is not for synthesis. We are waiting actually to buy a professional one. This bone mill is for analytical purposes. And as you could see, the chamber is very small, 4 milliliters. In this order, maybe you notice that very small quantity of reaction we could have done here. It's only 0.1 millimole of the desired compound. Using the other technique with conventional heating, as you said, we can do the reaction in 10 times higher scale. So it's very important to have like proper size bone mill if you would like to scale up the mixing. But in pharmaceutical industry, this is a much easier way to scale up the synthesis of bioactive molecules because they're affordable big bone mills, different types, especially planetary ones, which are utilized to this synthesis.
Thank you so much, sir.
Thank you so much for your presentation. I just want a little clarification. Can you please throw more light on the application of this mechanochemistry in catalysis precisely? Because we were seeing a lot of that the applications, but when you get to catalysis, I got my attention because I'm actually working on little thing on catalysis. So can you throw more light on application of mechanochemistry in catalysis?
Yes, as I mentioned that our reaction needs to be catalyzed with uh, acidic acidic catalysts in order to carry out the reaction. We need a proton, so we need acidic milieu. For example, we can use sulfuric acid or less strong acid like for example, triflic acid, not triflic acid, acetic acid with trifluoroacetic acid in order to protonate the formaldehyde to start the reaction. Once we apply this, for example, polyphosphoric acid on silica, we can make a catalyst which can catalyze our reactions. So we have acid which is supported on silica. We can use different porous materials to uh, position the acid on silica, and then we receive acid material which we can apply in our synthesis. This is heterogeneous catalysis when we use reaction in solvent. Actually, In this ball milling process, we don't have heterogeneous catalysis because we put all in powders, and this is not heterogeneous catalyst, it's just catalyst. So we catalyze our reaction adding this powder acid in order to achieve the results. The thing which you may notice is that we put such big amount of this acid on silica, as you can see, is 10 times more than the catalyst we used in the conventional heating reaction. And then actually we had success with proceeding to the target molecules. So in this way, we catalyze our reaction using this crystal acid, as if I can say, hard acid, in order to produce our target compounds in bone meal. So the application of catalysis, the other application of catalysis, which can be used in physical chemistry or the other levels, not levels, fields of chemistry, I am not very much familiar, so I can't talk on this.
Okay, thank you. Why I actually ask is because of the first question that talks about polymerization. You know, when you talk about polymerization, definitely you might talk about catalysts to enhance your reaction. So for you to have application maybe in for you to have application in catalysis, that means it will have effect in polymerization or application in polymerization in one way or the other due to the link it's having with catalysis. That is why I asked, due to the way you responded to the first question, that is not related to polymerization. Thank you very much, sir. Thank you. I appreciate it.
Hello, sir. Sir, I'm having a doubt whether for this mechanochemical reactions, do we need to do the reaction in the room temperature, or can we have it at some elevated temperatures?
So it depends of the reaction you would like to proceed by using what we want is to make it in the simplest way. Of course, we try first at room temperature, as we would like to be eco-friendly with minimizing all the expenses for heating or cooling. But with the bone meal, you have increasing in the temperature because it depends of the balls which are utilized in your bone meal. In our case, we have only two balls, and but if you have more balls and be different bone meal, if you are going to insert much more balls, the temperature is going to be increased uh, by the milling process because these balls interact with each other and make energy which transforms to heat, and actually in some point with the time you have you're actually increasing the temperature of the reaction. So from some of the reactions I showed today, the much difficult cases, we have some of them which actually proceed for 2 hours. Of course, that means that the chamber was much warmer than the one which we use in order to obtain the compound which we obtain for 15 minutes. So actually, it makes sense to check first on room temperature, and then with the different ball mills, you can actually make the it depends on the reaction outcome if you need to warm up or cool down the reaction, but yes, it affects.
Sir, one more doubt. Is the use of silica is kind of a supporting medium, or is it used for acidifying the catalyst that we are using?
We have tried with silica only in order to catalyze the reaction, but the trial was unsuccessful, as I mentioned, and in order to support the acid, polyphosphoric acid, we used silica. So actually, silica is only supporting material for the acid we wanted to use in order to proceed the reaction.
Okay, sir. Thank you.
Thank you, sir. Very nice presentation and very informative also. So I have a small question. So in the case of mechano chemistry, means there are a lot of optimization is needed in terms of its the ball and the size and the composition of the ball and the speed. There are many means optimization means is factors affecting the mechanochemistry. So can you comment on means how you compare the cost effectiveness and the convenience of this mechanochemistry with respect to the conventional techniques? Thank you, sir.
Yes, of course. Thank you for your question. I know this is quite interesting field, but we don't we are working on this for maybe few years. So what we've tried only is with the bone meal we have in our university, and actually is a little bit difficult by our laws to order and buy. I mean. Newer technique machines in order to use them. So we are waiting for a new bone meal, and then we are going to have different jars and bowls in order to compare the reactions. But yes, it's very important if we can actually use materials which are less toxic, eco-friendly. Of course, some of the materials in long time when they've been used, they can contaminate the reaction. But in this case, we have this bone meal I showed. We have two balls which are from the bone meal, which are metal balls, and we don't have the opportunity yet to uh, compare the reactions using different conditions regarding the materials of the mixing chamber and the materials of the balls and the quantity of the balls, because the volume of this ball is 4 milliliters, and it's not even worth starting a reaction with, for example, 1 millimole of the starting material. We have tried, but it was unsuccessful. Uh, we don't have any results even for a few hours. All become a sticky mixture, and the reaction wasn't observed after we checked. So in order to have reaction, we need to put much smaller amounts. But as I mentioned, the catalyst polyphosphoric acid support on silica was in higher yield. So it's kind of milieu of uh, take, proceeding the reaction instead of catalyzing the reaction, if I can say, because it's in much more condition. So actually, reaction proceeds in the uh, polyphosphoric acid on silica. While when we do this reaction with conventional heating, we just add 0.06 amount of this catalyst. So this means that we have much more amount of acid on the silica. So in this point, we haven't checked the the tension of these things, the material of the jars and the balls, and the materials made which the ball mill. But in the future, we will definitely check these parameters in order to improve the yield of the reaction and to uh, have some much better results. I hope if I answer your question.
Thank you, Professor, for the very informative talk on a very interesting